Hi everyone, welcome to my channel Ernest Talk. I am Veena Patil. I made this channel only for educational purpose, that too only on anesthetic topics from basic to anesthesia to a particular surgery. Um, I am making things easy as much as possible so that a common person also get to know what is anesthesia and how it is advancing and all. Guys, this is just an introductory class. Please support me as much as possible by subscribing this channel. I am new to this, so please be kind. So now let's move on to the topic, that is introduction to anesthesia. This is just an introductory class, but in next class I'll take a particular topic and I'll explain that in detail. This is just an introductory classes, that what is anesthesia, what all components are there in anesthesia, how many types of anesthesias are there, before anesthesia what assessment they will do and all. That is just introductory and overview class. In next class I'll take in detail. In this class, I'll cover these topics, that is history of anesthesia, terms commonly used in anesthesia, goals of anesthesia, uses of anesthesia, types of anesthesia, preoperative assessment and equipments. These are just like overview. I'll take overview of these topics. Next class I'll take in detail. Next, move on to the topic, that is history of anesthesia. When it comes to the history of anesthesia, anesthesia is advanced a lot and it is advancing also. Now also it is advancing. The person who experimented with nitrous oxide on a patient is Sir Humphrey Davy. You can see in this picture, this person is Sir Humphrey Davy. He experimented nitrous oxide on a patient, and the person who demonstrated ether as a surgical anesthesia is Dr. William Morton. This second person is Dr. William Morton. He used ether as a surgical anesthesia, and the person who used chloroform in a surgical field is Dr. James Simpson. This person, he used chloroform in a surgical field. Guys, now I'll explain three different centuries anesthesia evolution from 18th century to present day, so that you'll get to know how it advanced from basic to like present day. See, in this picture you can see this girl is or a woman is 1823 century woman. She is 1923 and she is present day woman. There is a story that how anesthesia has evolved from basic. Modern day surgery is only possible because of the innovation made in the field of anesthesiology. Uh, to know how it advanced from 18 to present day, there is a story. Now I'll explain that story in a in briefly. Let's look at how dramatically things have changed through the experiment called as women's with breast cancer living in a three different centuries. In 1823, this woman developed a painful tumor in her breast. In 1823, a woman developed a painful tumor in her breast. What she did, she electively agreed for the surgery. Before surgery, she took wine to dull her awareness. The surgery person gave her some wine to dull her awareness, still, but still, she has gone through so much pain during surgery. She has gone through so much pain during surgery. Uh, but although she survived for a week or some days, because she was taking too much opium and alcohol, she survived for a days to, for some days to for a week. But within a week, she died due to combination of emotional exhaustion, dehydration, and widespread infection, because during that time the people were unaware of surgical that sterile technique and sterility and all. They were unaware of the importance of sterility and all. In 1823, women died due to dehydration, emotional exhaustion, and widespread infection, because she was taking too much alcohol and opium. But in 1923, in 19th century, it is different. In 1923, a woman with same complaints, that is, a woman with, who developed a painful tumor in her breast, she agreed for a surgery. She posted for a surgery. They gave an injection called as morphine and scopolamine to dull her awareness, or as a pre-medicative drug, because they'll reduce anxiety. So they gave morphine and scopolamine as a pre-medicative drug. In this century, surgeons knew the importance of this thing, sterility and sterile technique, but they were unaware of. During that time, the antibiotics were yet to be discovered. So they used to monitor the patient, that there is a color change on her lips, color changing on her lips, and they used to monitor her radial pulse and all, because during that time they used ether as a anesthetic drug or a anesthetic gas. They used ether as a anesthetic gas. Ether is a very like nauseous drug, and which it will cause respiratory complication. Like ultimately it will cause it will cause respiratory failure also. So in 1923, a woman presented like a woman posted for a surgery to remove her breast, because she had a tumor in her breast. So to remove that tumor, she posted for a surgery. So to calm the patient or to reduce the anxiety of the patient, they gave morphine and scopolamine, combined drug, combined drug, combined drug, to reduce the anxiety of the patient. In that century, they were aware of sterility and sterile technique, but during that time, antibiotics were not yet to be discovered. So patient died due to using more amount of ether oxide on the patient, which caused respiratory complications like respiratory failure also. So, but in present day, it is completely or totally different, because a patient with breast cancer meets the anesthesiologist before her surgery to discuss about the anesthetic plan. They'll make a plan, like which anesthesia to give, um, what anesthesia is suitable for that patient and all. They'll discuss before only. Morning day, morning of surgery, anesthesiologist inject a mild sedative to calm the patient to reduce anxiety of the patient. When they take patient inside the operation theater, they'll give some drugs which are individualized for that patient, for that particular patient, and those drugs will make patient unconscious, and they'll place a breathing tube, which will give unobstructive breathing, and which protects the lungs. The patient heart rate, saturation, and other vitals are monitored using the latest equipments, like monitors and all. The vitals will be displayed on the screen. When the patient awakens in the recovery, she didn't feel any pain or nausea or vomiting or dizziness, or anything, because surgery has gone very smoothly. So because of that, she didn't felt any of these complications. What it illustrates, see, you can see, from from this era to this era, there is a lot of advancement na. So this illustrates the phenomenal advancement in the by the physician in the field of anesthesiology. We can see a phenomenal advancement from 18 to present day. uh, this is the story behind how anesthesia has evolved from basic to present day. Let's next movie We will move to the next topic, that is components used in anesthesia. Before we'll go to components of anesthesia, we'll see what is anesthesia. What is the meaning of anesthesia? All people know this word normally in their own language, but for like what for a particular definition, I'll like for a fixed definition, I'll give some brief introduction about anesthesia. Anesthesia means loss of sensations in all or part of the body without or with loss of consciousness. Means in Greek word, it is arrived from the Greek word. Anesthesia is arrived from the Greek word in Greek and means without. Aesthesis means sensation. So without sensation, the it is the meaning of anesthesia. Anesthesia means it refers to a lack of sensation that results in an animal. Animals means we are also evolved animals only, or like a person. Animal means a person not experiencing any sensations or feelings, and which are reversible also. It's not like if we gave anesthesia, a patient is under sedation and our work is over. It's not like that. We have to bring that patient back to his normal condition with normal vitals and all. So that is the main thing in anesthesia. We have to bring him back, or we have to bring her back to the normal state. That is the definition of anesthesia. Next, we will move on to the components in anesthesia. You can see here there are six components here. That they are amnesia. First one is amnesia. Amnesia means a loss of temporary memory. uh, Before surgery or before intubation, patient know everything. Patient is responding. Patient is responding. Patient can see everything and all. But during that mid thing, like intraoperative period, patient will be under sedation or under general anesthesia. Patient will not know anything. Huh? But after surgery also, she or he will not know everything because they can't remember anything, because we give some drugs which will lost the memory for a temporary reason. Like there is a particular period now. During that period, she'll whatever had happened now, she'll not remember anything only. That is the term we call it as amnesia. Means amnesia means loss of temporary memory. Next is analgesia. Analgesia means reduction, pain reduction. Commonly, pain reduction. We will not feel anything during anesthesia. Patient will not feel anything. If there is pain also, he'll not feel, because we'll give some drugs which are particular for the patient, like fentanyl, morphine. It's not like we have to give these drugs only. It's like depends on the surgery and the patient current status and all. We will give some drugs. But commonly known, common every person knows some drugs, like commonly known without prescription also they are available, like paracetamol, Tramazac, diclofenac and all. They'll use. Those are the analgesic drugs. That term is called as analgesia. Analgesia means pain reduction, inability to feel pain. That is the term analgesia. Next, we'll come to the narcosis. Narcosis means unconsciousness. Patient will be under sedation. No, she is unconscious patient, or he is unconscious conscious patient. The term is called as narcosis. You can see here unconsciousness. It is nothing but narcosis. Narcosis and unconscious both are same. It's a medical term na, so that is the difference. Next is the muscle relaxation or akinesia. Relaxation means absence of movement. Patient will not move his or her body during in general anesthesia. Spinal anesthesia, upper body will be like patient can move upper body like hands and all he can move, but lower body will be under unconscious status. But in general anesthesia, whole body will be under muscle relaxed state, because we will give some drugs like depolarizing, non-depolarizing. There is a classification. Non-depolarizing like vecuronium, atracurium and all, we will give in intraoperative period to manage the patient in intraoperative period. So they'll relax the patient's muscles. If a patient starts moving, there will be sympathetic stimulation, which will increase bradycardia, heart rate, and all. Tachycardia, hypertension, and all. So to manage that, we will give some drugs. And during surgery, if the surgeon is operating, if the patient starts moving, what will happen? He can't operate properly na. So to manage that also, that is the main thing actually. That is the main thing. So to manage that, we will give some muscle relaxation drugs like vicuronium, atracurium, cisatracurium, pancuronium and all. Based on the patient condition, we will use these drugs. So that term is called as akinesia or muscle relaxation, or even paralysis also we can say. Next is anxiolysis. You can see here, anxiolysis means patient while taking patient inside the OT, patient is scared or afraid of surgery. What they'll do with me, and all, like he or she'll be under some anxiety issue. So to reduce that, we'll give some pre-medicative drugs. To reduce anxiety, we'll give some pre-medicative drugs. Those drugs are like benzodiazepine group of drugs like uh, midazolam, diazepam and all. Like based on the patient condition, we will give those drugs. They'll reduce the anxiety of the patient. Next is the term sedation. Sedation means sleep only. Patient will be under sleep when in anesthesia, general anesthesia, but in sometimes in spinal anesthesia also. Patient, if the patient is uncomfortable or something, they will give some sedative, mild sedative drugs, which they'll calm the patient and they'll put patient in sleep mode. So these are the main components used in anesthesia. Next, we will move on to the types of anesthesia. Sorry, yeah, goals of anesthesia. What are the goals of anesthesia? There are why we give anesthesia. What is the need of giving anesthesia? Anesthesia means drugs and ventilator or anesthesia machine. These are the main two components. But why we give anesthesia? There is a there should be some reason now why we give anesthesia, and we give anesthesia for pain management, to reduce the pain of the patient, and sedation means sleep. Patient will be under sleep, to relax the muscles, to stabilize the hemodynamic vitals like heart rate, blood pressure and all. We have to monitor them and we have to stabilize them. That is the main goal. Next is respiratory support. We will give some positive pressure ventilation with the help of anesthesia machine. Patient breathing system will be under unconscious mode na, because we will give some drugs which they'll cause respiratory depression. So patient can't breathe spontaneously. We have to put the patient under mechanical ventilation, so which will give respiratory support to the patient. That is the main goal in anesthesia. Next is the amnesia. Amnesia, as we all know, amnesia means loss of temporary memory. Memory will be lost for a particular time. That is the amnesia. Next is the patient safety and comfort. This is an important thing. Sometimes patient will feel very uncomfortable during surgery. Most particularly female patients will feel uncomfortable. So we have to give them some comfort during anesthesia. Um, so if we give some anesthetic drug, patient will not know anything. So that is also safety concern. In concern, we will give some drugs, so patient will sleep, will fall asleep, and we can operate, like surgeon can operate easily. That is also main goal in anesthesia: patient safety and comfort. Next we will move on to the use of anesthesia. Why we give anesthesia? Why we give anesthesia? What is the use of giving anesthesia? In which field we will give anesthesia? See, to reduce the pain. Main thing is to reduce the pain. Pain management will give some anesthetic drug according to the patient current status, health status. And next is in surgical procedure. In surgery, we will give some, like according to the surgery. If it is like small surgery, we will give sedation. If it is like craniotomy and all, we will give whole body sedation, whole body. That is general anesthesia. If it is like a cesarean section or something, or uh, arthroscopy, orthopedic surgery, lower limb orthopedic surgery and all, we will give spinal anesthesia. Like based on the patient surgery, we will give some anesthesia. That is the in surgical field. Next, in dental work, like root canal and all, they'll give some local anesthetic drugs like lignocaine with adrenaline and all. So there also it is useful, anesthesia is useful. Next, in diagnostic test, diagnostic test like colonoscopy, endoscopy, sclerotherapy, sigmoidoscopy and all, we will give anesthesia. That like sedation, we will give some like 15 to 20 minutes, or 10 to 15 minutes. Patient will be under sedation, he can't feel anything, or patient will be under sedation. There also we will give some drugs, anesthetic drugs. But while performing that, we have to maintain the saturation of the patient. That is the main important, because in that period patient there is a tongue fall, which will cause apnea, and ultimately patient may die also. And for that reason we have to give some oxygen supply to the patient while giving drugs in diagnostic test. In obstetric surgery, in LSCS surgery, vaginal or normal surgery, there is no need of giving anesthesia and all. But in LSCS, in cesarean section, we will give spinal anesthesia, which will patient will not feel anything, like lower body will be under unconscious mode and all. After 4 hours, 4 hours or 6 hours, according to the how much dose we gave, patient's sensation will come back. There also it is useful in obstetric surgery, like cesarean section and all. There is it is also useful there, useful. Next, in critical care means ICU and all. um, ICU, they use some sedative drugs, and ventilator is anesthesia machine and ventilator is also present there, so there also it is useful. In veterinary medicine also, like in some pets or animals, they use some drugs to make the animal unconscious, or to sedate. There also it is useful. In MRI, in MRI, most of the pediatric patient, they'll not cooperative in MRI, because they are pediatric now, they can't stay in one place. So there we will use some anesthetic drugs to um, sedate the patient. Mostly geriatric and pediatric patients are uncooperative patients, so we have to make them feel comfort, or we have to make them under sedation. Otherwise otherwise they'll start crying. Probably pediatric patients, they're uncooperative. Geriatric also, but compared to geriatric, pediatrics are more uncomfortable patient. These are the uses of anesthesia. In which field we will use anesthesia there. Next, when it comes to the types of anesthesia. In anesthesia, we have majorly where there are three classification. That is general anesthesia, regional anesthesia, and local anesthesia. In general anesthesia, um, whole body will be under unconscious mode, or patient will be unaware of like anything. Patient can't remember anything. Whole body will be under sedation. We will place some tube to manage the respiration and all, because patient can't breathe spontaneously. We have to put him in under ventilatory mode or a mechanical ventilation. So you can see he is doing pre-oxygen prior to surgery, prior to intubation. After pre-oxygenation and all, and they'll insert a tube here, and which will give constant breathing support to the lungs. That is the general anesthesia. And regional anesthesia, regional, you can see here patient is sitting, and they are inserting a needle. Through this they'll inject some drug, which will numb the patient lower body, and patient can't feel anything. Lower body will be under no sensation. That is the regional anesthesia. In regional anesthesia, we have spinal epidural. Like in regional anesthesia, we have two classifications, like central neuraxial block and peripheral neuraxial block. But in central neuraxial block, we have spinal epidural, combined spinal, saddle block is there, caudal block is there, so many blocks are there. In peripheral also there are classification like upper limb block, lower limb block, and all. That is also a different topic. These all topics are different topics only, I'll take in next class. When it comes to the local anesthesia means numbness to a small area or a specific area of the body, like commonly for minor procedures such as suturing a wound. You can see this picture. There is a wound here or a incision here. They are injecting some local anesthetic here to the subcutaneous region. So here the area will be numb. This area will be in a no sensation areas. They'll inject here, and patient will not feel anything. No sensation will be there here, and they'll suture that area. That is the local anesthesia. In local anesthesia also we have two types, that is topical and infiltration. That is also separate topic. I'm just giving brief introduction. Next is the preoperative assessment. In preoperative assessment we will do a lot of assessments like um, we will take patient history and all, medical history like previous surgeries. Patient is having any comorbidities like hypertension, diabetes, or patient has gone on any undergone any surgery like previous surgery and all. We will ask them. And in physical examination we will ask his weight, his vital, his respiratory system, cardiovascular system also. We will assess these things. Next, in laboratory test, we have to send the patient for laboratory test because that is a crucial test step before surgery. Because if the patient is having any positive, like any HIV, HBsAg, HCV, COVID also, if he is like positive, it will cause like infection to whole hospital. So we have to take precautions before surgery. For that, we will send him for a serology test. With that we'll send some complete blood count, LFT, RFT and all. Also we have to test. Next is ECG, chest X-ray, and also has to done. Next is anesthesia evaluation. This is also a separate topic because in anesthesia consideration we have a lot of we will make a lot of evaluation because we have to monitor um, patient breathing, like patient malampathy. There are some classifications like malampathy classification. We have to assess the airway, um, and ASA grading according to the patient current status, health status. We have to assess that also. So, any allergy, if the patient is having any allergy to a particular drug, we have to contraindicate that drug in the surgery and all. So for that also we have to evaluate in the anesthesia. We have to assess the patient in anesthetic consideration. Next is patient education is also important. If the patient is uneducated, he don't know anything about anesthesia or surgery and or something. So we have to give them a brief introduction about what is anesthesia, which anesthesia they are going to give him, and what are the what are the post operative complications. Sometimes patient will be under sedation for some hour. Sometimes patient may require ventilator, ICU and all. And after surgery some patient may feel nausea, vomiting or something. So that also we have to explain them before only. Otherwise after, if we don't explain them before only, after surgery they'll start screaming. So we have to inform them before only because they don't know anything, they're uneducated people. So we have to inform them before only. That is the main important in anesthesia, patient education. But before surgery we have to take consent of the patient and patient relatives. It's not like only we have to inform to the patient, we have to inform to the patient relatives also. That is also main thing in preoperative assessment. And next we move on to the uh, in next class I'll take a, particular topic and I'll explain that in detail. And here we have some time limit, so I can't explain more. So stay tuned for next class, and I hope you enjoyed this class. And thanks for watching my video till the end. And thank you so much, guys. Stay tuned. Thank you so much.